Quick disclaimer. The Airway Circle radio podcast has been produced for entertainment, educational, and informational purposes only. All of the content, views, and opinions shared by our hosts and guests should not be a substitute for medical advice. Please consult your healthcare professional for any medical questions. Welcome to Airway Circle Radio, a podcast dedicated to conversations related to airway health, early intervention, sleep, breathing disorders, and practice management. Our series will showcase a few of my colleagues in what is sure to be insightful, thought-provoking, and engaging discussions. My name is Renata Nehme, and I'm a registered dental hygienist, certified orofacial myologist, and the founder of Airway Circle, an online resource center for airway professionals. I'm excited to introduce this educational format that has something of interest for everyone. Thanks for tuning in, and don't forget to subscribe. We are here with Dr. Meghna Dassani. Welcome.
So excited to be here.
Yay. Alrighty, guys. So I'm going to go ahead and introduce the speaker. Dr. Meghna Dassani is an internationally educated dentist practicing in Houston, Texas. She received her initial dental training from the University of Mumbai, India, where she graduated in 1996 as she operated a successful practice there for 6 years prior to moving to the U.S. She is a 2005 graduate of the Boston University Goldman School of Dental Medicine, where she was actively involved in research projects as she enjoyed working in communities surrounding the dental school. She has been practicing in Houston, Texas for the last 15 years. She has a passion for promoting health sleep through dental practices. In following the ADA's 2017 guideline on sleep apnea screening and treatment, she has helped many children and adults improve their sleep, their breathing, and their lives. Her books and seminars help parents and practitioners understand the essential roles of the tongue, palate, and jaw in promoting healthy sleep. So we are here today to talk about her newest book. So excited about The Tired Child. If you guys don't have this book in your office yet, I highly recommend you having a few copies in hand so you can hand them out to parents or to other professionals. But it's such an easy read, and it's so easy to understand for parents, especially that have all these issues and they are not being heard. So thank you so much, first of all, for writing it.
Oh my gosh, thank you. I know you took time out of your schedule to kind of proofread that for me and get your eyes on it. And yeah, I appreciate that.
Of course, what an honor. So let's start with some questions. And now that we're live on Facebook, I will also tell you guys we're going to be giving some books away tonight. So be ready on the keyboard in case I ask you guys some questions. And what else was I going to say? I'm not sure if you guys can tell how differently I'm speaking. It is so difficult. So I had my tongue tie release almost 3 weeks ago, and I'm having a hard time collecting saliva. And I'm having a hard time talking. My lower jaw keeps coming forward and it's hitting this tooth. This tooth is hurting all day long. And I'm super worried. Of course, my R's are different. My ass is different. I have a lisp now. So I don't really know what's going on. I feel like I'm all over the place. But I'm working and I'm getting on there. And I start expansion soon. So hopefully that will really help with all the issues that are going on now. But if you guys have some recommendations, I am here to hear. So let's start with, why do you think there is a sleep crisis of epidemic proportions affecting our children?
Yeah, it's, sleep, as much as we're all thankfully talking about it, and we are aware, we're raising awareness within our patient base. But let's think back to, I went to dental school twice, right? In India. And then even when I came here to Boston University, there just wasn't any knowledge, any training, any information that was shared with us. So when we as professionals are still learning, imagine how much of it there is that is undiscovered, undiagnosed, unaddressed, untreated. And we really don't know what we don't know about how much of this there is. And then now, as all of us that are on here that are now screening and talking to our patients and evaluating and assessing and treating them, there's so many people, well, among us too, right? You just had your tongue released. I have 2 girls, and I didn't know with my little one. She'll turn 15 in June. And I tried being the keyword to breastfeed her. And now that I'm thinking back, I'm replaying that reel. I had all those signs, or she had all those signs of like a tongue tie, but she does have a tie. The clicking, the discomfort. She was frustrated. She got tired. She was my classic textbook child. And I'm going, wait a minute. I'm a doctor. I'm supposed to know this. So, which is why I truly think it is an epidemic. It is of those proportions. And the more, and I'm so glad there's so much awareness that you guys are raising and, just everything that we're all doing to be able to get word out to parents.
Definitely. As I'm listening, I'm copying. I usually, when we have a presentation, I'm over here sharing this conversation. I forgot about it. So if you guys are on Facebook, share it for us in the Airway Circle state group pages, please. So I totally agree. I mean, I'm one of those also that I had so many issues with my children. I always say this, that I wish I knew then what I know now, but I do believe that we are still blind to our own issues and our own children's issues. And I say that because, even going through the tongue tie release, like I knew what to expect. And I'm calling the girls from Airway Circle. What should I do? I'm feeling this. What should I do? What exercise should I do next? And we're all, helping each other. You kind of forget. I'm like, oh my gosh, can I eat anything hot? Can I eat anything spicy? Can I drink anything hot right away? Like, It's kind of like you just forget, what to say when you have patients that have these questions, but all of a sudden when it's you or your child, I do believe it's more difficult. So even though we are in this field and we do know the things that we know,
it goes out of the window when it's your loved ones. It just flies out of the window.
Yeah. See, we had to talk Renata off the ledge, Kimi saying. But it is so good to have this community of professionals and providers that we are collaborating together and we're talking to each other and we're helping these patients. And there is no judgment.
That's what I love. There is no, oh my gosh, I'm going to look stupid, or what are they going to think, or what is she going to say? Like none of that. You put it out there. It's like knowing we have each other's backs. Like I think that is fabulous.
Wait until I have a huge diastema. It's going to happen very soon. And I'm talking even more funny than I am right now. Patty's saying, thankfully, there's more and more awareness through social media and clients are calling to ask about sleep. Definitely. Yes. People are so interested in this topic now. And it makes me so happy because, of course, we all know how important sleep is. And it's just not treated the same. We all know that we do everything that we have to do and sleep is the last thing. We always push that. And for us also, we work so much. Usually people in our field, we're communicating at 10 o'clock at night, calling providers and going, let's talk about a patient. Also, a lot of us are sleep deprived, but just as a community to push each other to, even the girls in Airway Circle and I want, once in a while we'll go, okay, we got to go to sleep. Everybody needs to go sleep. So pushing each other to make sure that we are making good decisions and focusing on our sleep, because you cannot function at 100% if your sleep is at 40 or 50%.
And then, well, you're way too young, but my generation, I grew up with, my parents or even my older siblings saying, oh, I'll sleep when I'm dead. I'll have the rest of my life to sleep. And you grow up hearing that because hard work is what's going to get, yes, it is, don't get me wrong, but not at the expense of sleep. So there's some mindset shifts as well that we have a responsibility to create within our patient demographic, our families as well. We're literally hitting the reset button on all of that.
Yeah, Elena's saying not sleeping to understand how to help my patients sleep better.
There we go.
I don't know if you guys follow the Diary of a CEO, Stephen. He is amazing. He has a fantastic, I think it's like #1 podcast on Apple. And he recently shared something saying, my sleep right now is #1. My health is #1 because without my health, I'm nothing. And I love all the social media posts and all this awareness that you guys are doing. You know what I mean? It doesn't matter if it already has been posted or spoken about 100 times, do it again, because there's new people coming in all the time. And there's always somebody that needs to see that or needs to listen to that. So I always encourage everybody, even if you think it's something silly, we should sleep this many hours a day, or anything, just put it out there. You're going to reach people that need to hear.
Right. And people a lot of times need to hear or read things multiple times before it actually clicks. And then they're able to like connect it up. Wait a minute, I saw another post the other day. And that's when it sometimes really hits home for them. So yes, absolutely.
I love that. Yes, even, I will listen back to our webinars and I will catch stuff that I did not when I'm sitting right in front of you listening to you. I'm like, oh my gosh, they said that. So yes, definitely listening to things more than once is amazing. Let's see, our second question. What prompted you to write The Tired Child? How sleep and sleep breathing can change your child's life?
Yeah. So my previous book, Airway is Life, I wrote that with a focus on families. And I was like, I'm going to give information. So a mom, a parent, anybody can pick up this book and have some takeaways for everybody. And I touch upon kids a little bit too. But then 2020 really hit it home for me, because as much as I hated everything, with people getting sick and, us losing loved ones and all of that. But what I found is we all stayed home. And there was no escaping the fact that a child was not sleeping well, or your spouse was snoring, or, whatever that may look like you were stuck together. There was no way out. You couldn't go to work early in the morning to escape any of that. And I found that really drove it home for parents, because we were stuck home. The kids didn't have daycare to go to. And, with the questions that I got from my patients, the phone calls that came in, I realized it would be a disservice to not address this in detail just for the children. My why started with treating sleep started with adults, losing a family member, transitioned into pediatrics for Avery, Christina is my office manager, been with me for 13 years. And we started to see all of this in her. And I was like, oh my gosh, how are we missing this? If I'm missing this, if I'm treating sleep and I'm missing this, good grief, we need to address this. So just tying everything in together. And I was like, we got to do something for the kids. There's just no two ways about it. Because at the end of the day, each of these kids are going to be our doctors, our engineers, our educators, they're going to take care of us. They're the future. Mm-hmm. They are our future. And if anything, we can impact their lives right now, give them a better start. Good grief, why would we not?
Oh my gosh, how much does your brain grow from the time that you're born until the time, you're not a child anymore, even 12 or 18? We really need to be focusing. I actually have a few patients right now that are 4 or 5 years old. And I've been noticing more and more when I'm doing consultations with patients that I'm choosing not to treat them. And I'm not sure if there's other myofunctional therapists going through the same thing here. But I'm stepping back a little bit more and I'm looking at the whole picture. Mm-hmm. And these young kids, 2 of them came to me and they sound like this. Immediately you can tell it's a nasal issue. First of all, you cannot push a child to keep their tongue up if they cannot breathe. Exactly. It's not going to work. So if their jaws are too small and they can't fit their tongue up there, or they have a tongue tie, there's all of these things that we all know that we have to look at. But I'm finding myself now doing my consultations more times than not saying, I'm going to give you 3 months. This is what you're going to do. We're going to do ENT. We're going to do sleep study. We're going to do CBCT. We're going to get expansion, whatever it is. And then you're going to come back to me. With that being said, I always give them recommendations. The things that you can already start. Yes, let's start clicking your tongue. Let's start brushing the tongue in the spot. Let's start nasal hygiene, tons of nasal hygiene, eliminating all allergens. So there is some guidance that I can give them, but doing myofunctional therapy in an extreme deficient structure or an extreme enlarged soft tissue, things that are going on, it's just not going to work. And we need to realize that as myofunctional therapists, because we don't want people to turn around and be like, oh, I did myofunctional therapy, didn't work. So we got to be very precise, and it only works like that when we are collaborating with other professionals. So I said all of this to say that I sent these patients to somebody to get expansion or get, tonsils and adenoids, and they can't find the help that they need where they are.
Sometimes they don't know what questions to ask too. That's the bigger problem, I think, because they have you guiding them. They go there and they're like, what do I say? Or, when, like you said, they can't find somebody. So I agree with you 100%.
And I did contact a few friends that thankfully I knew around where they lived. And I said, I need expansion in this 4-year-old or 5-year-old. And they said, well, where's the research? The expansion actually works in this. I can't do anything without research. And I'm like, oh my gosh. And then people are like, well, it's a risk to do anything that's not research-based. And then my answer was, is it a higher risk that, letting this patient go to sleep every single night, pretty much causing the brain damage with lack of oxygen going to his brain and not do anything? That's also doing harm. So we got to figure it out. If you don't have the training, if you don't know how to do expansion in young kids, let's find out courses out there. There's plenty, right? There's plenty of professionals nowadays that are trying to teach. So let's start bringing in people that are interested, but are still not in airway. Let's give them some research and get their feet wet and invite them into our group so we can help these patients that are in some areas that they can't find the right professionals. It's a big issue. Why did you decide to write the book with parents and healthcare providers as the target audience? I think you mentioned that a little bit already.
Yeah. I firmly believe that as professionals, yes, we are doing our part. We're being aware, we're getting trained, we're raising awareness within our parents. But what about those that don't see providers that are screening or assessing or evaluating? How can we reach them? How can we get their eyes to open to this? How can we get their brains to start thinking that, no, I wasn't crazy. My kid really does need help. Or I'm not a mom that wants my kid to be, how sometimes they're like, you're making it up. No, it wasn't me. Maybe I need to look for somebody that can help me. So that was my goal. Yes, I'm already training doctors. I have the coaching and all of that, and I'm impact those. But what about those that don't have access to those doctors? So which is why I decided to do something that focused on a parent.
I love it. Can you tell us, since we're here, can you tell us a little bit about your coaching program and what do you do?
Yeah. So I coach dentists and their teams, so whoever, their hygienists, assistants, on how to implement sleep apnea services within their practice. So I go over both adult as well as pediatrics. We talk about oral appliances. We talk about what appliances, how to choose them. In the adult sleep apnea portion, we talk about medical billing. How will you bill for it? How to have these conversations, how to get the team onboarded. A lot of docs struggle with the team thinking, oh, this is one more thing I have to do. And it can be because we're adding a new service, but there's a way to integrate all of this seamlessly so we don't feel overwhelmed. Once the team understands the why behind it, let's be honest, most of us have somebody in our life that is impacted. And I find that then it's like for my team, this is their legacy. They're like, this is ours. You go make crowns and veneers and do beautiful stuff. Sleep is our legacy to our patients. And I was like, yes, own it. So that's what we do. My team is also part of this. So, team members too, your team members do it. And of course, I teach the doctors.
I love that. And they can find that information on your website?
Correct. It's either meghnaDassani.com or sleepsuccessacademy.com.
Perfect. I'll make sure that I'll post that on, or one of the Airway Circle girls here, please can post that on Airway Circle Professionals Facebook group so everybody can have access to that. Let's see. Why is sleep so important for children? And what is about our culture that runs counter to that?
The first question to answer that would be like preaching to the choir. Everybody here is here because we know why sleep is important for our kids. I'll give you the short answer since there is a question and I want to answer it. It impacts growth and development and how our kids' brains grow, and lack of oxygen, we know, impacts their health from how they feel when they wake up in the morning to, potentially cardiac issues. We know everything. Kids sometimes having diagnoses of ADHD when it might just be sleep deprivation, bedwetting in older kids, behavior issues, trouble focusing, So much that goes on with that. So yeah, that's why sleep is important in our patients. What was the second question?
And why do you think that our culture runs counter to that? I think that one of the issues that I see with our culture is one, the time the kids have to be up to go to school. My gosh. And the younger they are, the earlier they have to be in school. That to me doesn't make a lot of sense. When I was at Sleep 2022 meeting last year, they had a whole group of people who actually passed a law, I think it was in California, to change the school times for children so they didn't have to be up so early and they could get their REM sleep.
Oh
but they focus,
yeah.
But they focus on teenagers, but because teenagers are up later, but then they tend to sleep in. But how about the little ones that their brains are developing? I mean, I talk to some parents sometimes that they're waking up at 5:30 or at 6 to be, I know it's so early.
Yeah, that hurts my heart to even hear that they have to wake up this. Well, even my teenagers, I have a freshman and a senior, and we know with their circadian rhythm shifting at this age and the hormones, and then, social media and their phones don't help, and sports and homework and college apps and everything just plays a role. So there are nights, mornings, I don't know what to call it, when they don't go to bed until 1:00. And then I hear their alarm go off at 6 when I'm leaving the house. And I was like, wait, let me think. How many sleep cycles did you have? Not very many. No wonder you're tired when you come home. And to think we allow these kids to get behind the wheel of the car, right?
Oh my gosh.
I expect them to drive. So there's a lot of change that needs to happen for sure.
Trisha's saying there are also so many health or dental professionals that never grow beyond their initial education, and questioning that is not everything they were taught is still relevant, or that information is constantly changing as research comes available. Definitely. It's not everybody that chooses a profession for the love of it. We all know here that our profession chose ourselves. That's why we're here on a Thursday night, still learning. But unfortunately, it's not like that with everybody in the healthcare field. So finding those special ones that are willing to learn a little bit more because they truly care about their patients, they truly want to help. And they're out there. We just got to find them.
Change is scary too, because we've spent so much time, money, energy into learning and honing our skill, right? And then to pick everything up and then now try to add this, and life is still happening. So I tell docs, I tell parents, it's is that what you want your cardiologist? If you're going to go in for heart surgery, do you want them to practice the same thing they did 20 years ago, even 6 years ago? No. I want somebody that went to a great new CE and learned robotics, the newest thing that's out, right? So why are we hesitating to provide that for our patients? Why are we hesitating to learn?
Oh my gosh, that's such a great point. I love that you mentioned something about how sleep changes in teenagers with their hormones and circadian rhythm. Can you touch a little bit more on that?
Yeah. So, I'm fond of telling parents that as we go through life, kids have babies and infants, have to wake up a certain amount of time at night because they're feeding, their bellies are small, whatever. They go through it. They get to a certain age and then they follow your and my sleep cycles. They want to go to bed when we go to bed, and they wake up when we wake up, actually even later, because they need more sleep. And then they get to this preteen teenage where, again, because of all the changes happening, circadian rhythms resetting, hormonal changes, now these kids, and a lot of these, I have to remind parents, your teenagers are not bad. They're not doing this to annoy you, to piss you off. It's truly their brain cannot fall asleep. So then these kids end up needing to stay. They just can't fall asleep at 9 p.m. when I want to go to sleep, or even sooner. And the circadian rhythm has shifted to they fall asleep later, which means they wake up later. And that goes on until about their 20s. And then they start to shift back into what I call normal human beings. So you and I go to bed at a time that's decent and then wake up. But then we also have some, your early morning some kids want to be up, like even between you and I, right? All of us that are in this room, some of us are morning people and some of us are night owls, and some of that's genetic. So there's so much that goes into play. But what happens is we try to fit everybody into a box. Like you were mentioning earlier with school, it's like, oh my gosh, we expect like our kids and our preteens and our kindergartners to wake up at 6 a.m. and go to school early, just so we can get more activities done and, have a whatever day structure. But we can't fit everybody into one box because structurally, DNA, genetically, you may be wired differently. Some people they're meant to be night shift workers. That's how their brain is structured. And then there's people like me, like come 8 o'clock, I'm like, are you in bed already? Let me set the alarm. I got to go to sleep. And I'm one of those people. I have to wake up early in the morning, which is why I'm in the office by 6 a.m. Like we see patients
wow.
at 7. Yeah, we see patients starting at 7. So the moms love me. They're like, we can bring our kids before they go to school.
Mm-hmm.
So, yep.
That's amazing. What can we do to help our teens get better sleep? How can we emphasize the importance of sleep at that age when that may not be a priority for them?
Yeah. The biggest thing I would say is have grace, have understanding for them, because a lot of it truly isn't in their hands. Now, I know watching TikTok is in their hands. But let's be honest here. But just understanding that a lot of it is the shift in their circadian rhythm. So sleep hygiene goes a long way with these kids, a long, long way. And sometimes actually allowing them to sleep in when they need to. So my kids are allowed, they don't have weekend morning activities. They're allowed to sleep in for as much as they need to or want to. And that's not uncommon. Like we're just coming back from 2 days of all day tennis. I know my kids are barely going to come out of their room because they're going to sleep in, and they may come out at 1 p.m. Who knows? But sometimes just allowing them that. But to tie everything into it is sleep hygiene. So emphasizing that for our children. I also see, I was at this tournament, like I was telling you, and this was high school kids. It is insanity how much caffeine these kids consume.
Yes.
I just sat there looking at like, oh my gosh, like even some of these popular drinks, and I'm not even talking Starbucks, like you go to Taco Bell, and I didn't even know this, I had to look it up, the Baja Blast slushy or whatever that is that every teenager wants is Mountain Dew.
No way.
It's frozen Mountain. I was like, wait, you're drinking this? So our kids are consuming insane amounts of caffeine, from like, the little fancy cans that they walk around with to Starbucks to stuff like this. So I think actually pointing it out to them as well is, and then not to mention all the sugar it has, not to mention all the unhealthy chemical, like the color and the flavor is, come on, we know it's not real cherries in there, right? It's like artificial stuff. So I guess our part as parents is to educate our kids, and a lot of it is going to fall on deaf ears. I can tell you because I have two, but I think sleep hygiene goes a long way for these kids, for teenagers.
I agree. And yes, all these drinks are just popular. And my Lord, teenagers just, that's insane. I had no idea. Mountain Dew.
I had to look it up. I was like, what is this? Because I've never tasted Mountain Dew. I can't even think about it. I was like, what is this? What flavor is it? You Google it. I was like, oh, it's frozen Mountain Dew. Oh yeah, never mind.
Oh my goodness. And how about schools? Are schools still able to serve, have the soda machines and all of that stuff? I wonder.
I don't know. I think it truly depends on the state and on the school district. I'll be honest with you. I think that it depends on that. My kids take lunch from home, so they dislike that food.
Oh, I wish.
Schools do have soda machines.
Lacey said the new popular one is Prime. Had tons of caffeine too. I haven't heard it yet. I don't get out of the house, so I don't know what's going on in the world. You guys tell me.
I don't think that's a bad problem.
Oh my goodness, sometimes. I guess we had a tornado warning today. And somebody messaged my nanny and said, oh my gosh, you guys okay? There's a hurricane warning or a tornado warning. She was like, did you guys know? We're like, no. Does Renata know? No. We had no idea. Kids were outside playing. But what should parents be alerted to that they may not know yet about the warrants further, or what warrants further assessment to rule out a sleep condition, pediatric sleep disorder breathing or OSA?
Yeah. So the biggest one I say, if you have a child that's consistently waking up grumpy, right? Or as we say, waking up on the wrong side of the bed, like not everybody wakes up in a bad mood every day. I have lately heard more and more kids complain about headaches as well. So when we know that kids, or even adults for that matter, when I ask about headaches and they say, oh yeah, I have headaches like X number of times a week, 3-4 times a week, my brain automatically goes to, is there an oxygen deficit? And then I follow it up with, well, how does it get better? Do you have to take medicine for it? And a lot of these kids go like, no, when I wake up and I brush my teeth and I shower and change or whatever, it's usually better, which means they've reoxygenated. So that is a huge red flag for me. Yes, we know about the mouth breathing, but again, a lot of parents are not aware of the mouth breathing because kids are in their own rooms, the door is shut. And, if they're not babies, a lot of times I don't check in on my kids. I mean, they're teenagers. So I don't know if they sleep with their mouth open. So I always tell parents, if you notice that open mouth posture, if they are at the breakfast table looking at their phone, or if they're sitting there doing homework, or if they're watching TV in the family room, is that how they are? Day mimics night. So if I see that during the day, that should be my red flag. Because I used to ask, it's like, does she sleep with her mouth open? And I'm like, I don't know. Like she sleeps in her own room and the door is closed. So you have to kind of ask those questions as to what's going on. Behavior issues are a huge one for someone that's super tired during the day or has trouble getting along with their siblings, or if they're in the practice, for us, it's like you have a child that has ants in their pants, can't sit still, it's constantly touching everything. Those are signs that of course, we always do the screening, but you always want to dig deeper. And these are things that kind of start to connect the dots for us. Snoring, of course, is a big one.
Yes. Yeah. Yes. And we all know how a lot of people think it's cute for their kids to snore. And we see that posted all the time. I am trying to find a video that I recently did of Zoe, because it's also important for parents to, here it is.
I did see that. That was when you all went to the zoo. Was that the one?
Oh my gosh, which one? I have to record Zoe all the time because she is something else. This morning she was telling me, because I caught her snoring. And that's what's important for parents to know, that it may not be every night. And it may not be all night long. It may look different for every child. So Zoe once in a while now will snore. And I just started catching Benny gasping for air. I mean, gasping for air. I've never seen him do that before. So I don't know exactly what's changed. Are his tonsils more enlarged now? I'm not really sure. But they are starting with these different symptoms. Zoe's gone through expansion. She did an RPE. Now she's on an ALF. But let's see if you guys can hear. I caught her. I tried to close her mouth. And silence. I'm trying to look at her tongue. The awful parent.
Oh my gosh, I don't think we're awful, but it's so bad. I'm sure your kids do the same. Like they'll look at other kids and go like, Mom, that child is mouth breathing. I toured college with my older daughter this past week, and we had a family that we're touring to, and they have a very obvious mouth breathers. I mean, very. And my daughter kept like, Mom, she's breathing through her mouth. It's like, okay. But yeah, no, I don't think we're awful parents. I think it's great that we're trying to do the best we can for not just our kids, but for all the kids that enter our lives.
Cherie saying, I took a video of my teenager and showed it to her. She said, Mom, stop. That's what my teenager says to me too. To Angela. Yes, but Zoe was like, I was snoring. And then she asked me last night, Mommy, did I snore last night? I was like, no, last night I didn't hear you snore. She's like, I can't snore. That is not pretty. Like, it's not cool. I can't. And then she started asking me about her kid.
That kid of yours is a teenager in how old is she? 8, 9?
8.
Yeah, in an 8-year-old body. She's a teenager.
And then she started asking me about all her friends. Do you think that person snores? That her friends at school is like, oh, that one definitely does. How about that one? But it's funny now. She's starting to look at the signs also. We know that when children can't breathe properly, they cannot sleep. How can parents identify when their child may not be breathing properly if they seem to sleep just fine? We said a couple of things already about their behavior, mouth breathing at different times.
Correct. And the only other thing I would like to add is, you mentioned the snoring. I am fond of telling parents audible breathing in a child is also a red flag. Snoring in a child may not typically doesn't look like what you and I would if, an adult snores is completely different. So if you have a child that is consistently breathing audibly, get it evaluated, get it looked at. And then growth and development, right? If you see, well, for you and I, of course, we know we're looking at growth patterns and such. Those are my big, big clues.
And I always say that lips closed do not equate nasal breathing.
Yep, you don't know where that tongue is.
Don't think that just because the lips are closed, and a lot of parents will say that, no, but they don't mouth breathe at all. No, they're breathing through their nose. If your tongue is not fully suctioned to your palate, creating that vacuum seal, you're not getting all the benefits, especially of facial or orofacial growth of nasal breathing. You need that pressure, that negative intraoral pressure in order for everything to work properly. If your tongue is low, it's low. Even though you're breathing through your nose, you're not going to get the craniofacial development like you would like to. And yes, Patty, she's my functional therapy mini. Me, she's already working at this age.
The only other thing I would add, I'm sorry to interrupt you, we were talking about a previous topic, is when we have children that are constantly wanting to put things in their mouth, constant. And they may not be active thumb suckers, but if you have a child that needs something in and around their mouth, is constantly fidgeting, get that evaluated. There's more that you will unravel as you dig deeper. And that's where the team effort comes into play. Because as much as I want to believe I'm Superman or Superwoman, we cannot do it all. I need an ENT. I need a sleep MD. I need an SLP. I need a myofunctional therapist. I need everybody to help create that team that's going to help this child get to where we need to. Well, even adults now, it's like I send my adult patients for myo as well. Mm-hmm. They'll see the ENT for an evaluation. They'll see the sleep MD. So our patients, it's literally a team effort, body work, working with a craniosacral therapist, an osteopath. All of that needs to happen.
100%. It is a whole body approach. Let's end with, which we mentioned that a little bit. What are 3 simple changes parents can make now to help avoid the tired child syndrome? 3 changes we can make now.
First thing, and I don't know if this counts as a change, but first thing I would say is have conversations with your doctors. If you suspect, if there's even an inkling of doubt, if you're just like, I don't know, I'm not sure, ask. Because there's nothing stronger than your mama gut. That gut instinct, nobody knows your child better than you do. So I would say that is number 1. Number 2 is getting onto a good sleep hygiene routine, being consistent with bedtime and wake up time. I cannot tell you how big of a change that is in just what sleep looks like for that child. So that will be number 2. Number 3, and I know it's overrated. We all say that. I'm not always the best at it, but making sure like we're actually exercising enough. They're getting outside time because we want vitamin D, you want the sun, your dark light, sleep cycles, and all of that to go through, and the food that they're putting in their body. Obviously, the new drink Prime is not good for them, as opposed to let's eat an apple if you really are tired or sleepy. An apple wakes you up just as well in the morning as a cup of coffee does. Yeah. And I had a 9-year-old the other day that came into the office and asked if we could make him a cup of coffee. I was like, no, you absolutely not, because he was tired and his mom allows him to have coffee. I was like, no, you may not. I know it's sad, but they don't need caffeine at this age. So I'd say those would be my top 3 changes that they could make.
Thank you so much, guys, for being here. Dr. Dassani, you're always such a joy to speak to. Thank you again for writing this book and for being here with us. Have a wonderful night. Bye-bye, everybody. Thank you for listening to our radio-style broadcast, where we bring different perspectives to the airway world in an easily digestible format. Different hosts, different views, same airway talk. Don't forget to leave us a review. Bye-bye.